you've been on insulin, and as you know, you're getting injections multiple times a day, or even if you have a pump, it is given subcutaneously. Your A1C may be perfect, but 40% of diabetics who have a perfect A1C will have neuropathy, kidney involvement, nephropathy, and visual, retinopathy, in spite of normal blood sugar control. When you fill your car with gasoline, the engine won't start a full tank. Doesn't do you any good. We ignite that energy production system in the liver. I'm Dr. Cunningham, and I'm the medical director for Mitokon. This treatment is designed for all diabetics, primarily type 1 and type 2, especially if they have complications. Damaged nerves, neuropathy, visual, retinopathy, kidney involvement, nephropathy, damages that occur as a result of your diabetes, in spite of maybe fairly normal blood sugars and a good A1C. Mitokon treatment is different. You receive insulin intravenously in a pulsatile fashion every 5 to 6 minutes. The Mitokon treatment will improve your energy, that extreme fatigue, indifference, and not feel like doing anything, that should go away. When you feel better, your mood is better.
I was really upset when I found out that my blood vessels have shrunk because of this crazy disease. But my doctor's like, there's nothing you could have done. You've done everything I've asked you to do. It happens. Now that that's being reversed, yeah, I mean, there are things out of our control. We can't control it. I have a soon-to-be 14-year-old daughter and a 10-year-old son. Didn't feel like I could do anything really. I was tired all the time. Like my daughter would come up and she was like, let's go for a bike ride. And I was like, babe, I just can't. I just don't feel like I can right now. Or let's go swimming. No, I'll go, but I'm just going to hang out in the water. I'm not going to play. Yeah, Joe comes up and says, let's go play Frisbee. Well, let's go play. You know, there's not anymore. I can't. Let's go play catch. Let's go hit. I'll throw to you all day if you want to stand there and hit all day. I wasn't able to do that before. My hips don't hurt any longer. My body doesn't hurt. I've lost some weight. I was having a lot of joint problems, like inflammation in my joints. So as far as neuropathy, I didn't even know I had any. That's all gone. I'm not crabby, which apparently was a problem. I didn't notice it. Just from the things that reverses that we had no control over. The disease will always rule our lives, but not to the extent that it did.
When you come into the Mitokon clinic for your consultation, we'll review your past medical history, your current medications, and any complications you're having related to your diabetes. When we all agree that you're a good candidate for the Mitokon treatment, we will then have an appointment set up for you to meet with Dr. Cunningham, where he will review your medications, your past medical history, and order a lab panel. Once that is done, we'll be able to set a first appointment for your treatment about 7 days later.
I'm Beth, and I am the nurse here at Mitokon Health Center. Then you will meet with me and we will discuss your preparation for treatment the following week. On your days of treatment, and this is really important, you need to make sure that you're coming in with a blood sugar of 150 or higher, so you must check your blood sugar before you leave the house. And if it is under 150, please do eat something high in carbs, low in fat, and low in protein. And this is because we do want your blood sugar to be higher on your days of treatment. So if you are using a pen or any other kind of injectable, you will skip that morning dose.
When you come into the Mitokon office, we do a neuropathy assessment on you. We check your reflexes and your ability to detect vibratory sense with a tuning fork. And we're able to demonstrate is dramatic improvement in fact. In fact, usually one of the first things improves.
Once your vitals are taken and your blood sugar is good, we will start an IV in your hand or your arm.
To put it simply, that pump is doing what your pancreas should be doing already.
The Mitokon treatment takes approximately 3.5 to 4 hours. During the treatment, you can expect to maybe be a little sleepy. You can curl up with a warm blanket if you'd like. You can watch TV, play games on your phone. Occasionally, we may ask you to get up and walk around the clinic to help the process of the treatment.
We are going to check your blood sugar at least 9 times, and you are going to get 9 dextrose drinks with every blood sugar check that we do. And the whole point of that is to mimic receiving a whole meal. Basically, you're getting 9 meals while you're here.
Once the treatment is over, we will do one last check of vitals and blood sugar. Make sure everything's all good. We will remove the IV, and then we'll see you 7 days later for your next visit.
And one last thing, we do want to continue to monitor you throughout the day. Continue to monitor your blood sugars, write down how you're feeling every day, and keep track of any possible changes that you may be experiencing, and then we'll see you next treatment.
At the outset, I did treatments myself, and I noticed energy improvement and particularly sleep. And I'm not a spring chicken, 82. The first week you get 2 treatments. After that, they are weekly, 4 hours each, until we recheck you, usually at 12 weeks, and then we may decrease, depending upon your improvement, to every 2 weeks. Usually within 2 to 4 weeks, for sure, you will notice a definite difference. Usually the first thing is your overall energy production increases. Patients have said they're dreaming for a change. Before that, they didn't remember any dreams. The good side effects, the good news is you feel better, you sleep better, your mood is better. Definitely the Mitokon treatment can strengthen the immune system by improving the strength and activity of all cells of the body because their energy production is improved toward normal. When you strengthen the immune system, you strengthen your response and speed up healing from all kinds of infections, pneumonia, skin infections, ulcers, even the common cold. You will have to continue your other diabetic medications. We have noticed, however, that your blood pressure may improve and you may have to decrease your blood pressure medicine. Many patients have noticed that their depression has improved and they're able to decrease or discontinue antidepressant. The Mitokon treatment is very safe. It's been done for almost 20 years now. It has had peer review. We've had a lot of universities look at this and there have been no major problems.
Yes, the Mitokon treatment is covered by most major medical insurance plans. Currently, we do not accept Medicare or Medicaid. If you are on Medicare or Medicaid and would like to receive the Mitokon treatment, you can by paying cash.
We can't wait to see you and feel better, I'm sure of it. The good news is it really works.